Hello to everyone attending the Gathering of Kindness. My name is Sue Robbins and I'm speaking to you from Canada. And I'm very excited to be having a conversation with another Canadian author named Karen Klak. And for the next 20 minutes or so, we're just going to have a talk like we're sitting around a kitchen table about our books, which are both about our experiences in healthcare. So welcome, Karen.
Thanks, Sue. It's very nice to be here. It's an honor to be doing this with you.
So why don't we start by talking about how we first met? So we both know each other, just kind of to let everybody know. I live in Vancouver, Canada, and Karen lives in Edmonton, but we first met when I lived in Edmonton. So why don't we start with that story and we'll go from there.
Mm-hmm. So the first time we met was actually in an interview situation, and you happened to be one of the two people interviewing me for a position on a new family-centered care council that our children's hospital was starting. And a healthcare professional that I knew from the hospital happened to be chatting with me. It was about 10 months after my daughter had passed away, and she mentioned this council and suggested that I apply. So I did and ended up getting an interview, much to my surprise, because I knew nothing about what family-centered care meant or what this was about. But when I entered that interview and you were sitting there with your warm smile, you asked me a question. And the question you asked was, "Tell me about Haley." And I'm sure I fumbled with my answer because in that previous 10 months since Haley had passed away, I was starting to sort of formulate a standard response for the question, how did she die? What happened? And here you were in your beautiful, kind way saying, essentially, how did she live? You wanted to know about Haley as a person, and that meant so much to me. Anyway, that started our journey together, and I don't know how you had the sensitivity to ask that particular question of me.
I was thinking about that, why I asked that question, and I myself haven't not had the experience of having a child die, but when I lived in Winnipeg, I had a very close friend whose son was stillborn. And I ended up writing an article about the experience of being her friend. And my friend taught me so much about what she needed after her son had died. And a few of the things that she taught me were like, don't be afraid to bring up my son because I haven't forgotten about it. Of course, he died. She said, I think about it all the time, right? So she said a lot of people are afraid to even bring up, her son or her son's name. And that was something really important to her, that people mentioned his name, and his name was Scott. And so I remember practicing before I went over to visit her, saying his name out loud, because I realized that we so often avoid saying the person's name, right? And how painful that was. And then the third thing she taught me was saying his name and talking about him and memories was, a way to keep his memory alive. And that was really important because one of the things she was really afraid of is that people would forget about him. And so I have to say, I have to thank my friend Maureen for teaching me, not to be afraid to ask about Haley. And I think I remember I said, was she like a girly girl, or did she what kind of things was she into? It was such a great way, I think, to start our relationship. And what Maureen taught me was to not be afraid. I guess that was the number one thing she taught me. And I'm not sure, everyone's experience is different, and I don't know if everything I said was valid to you, but, do you have a sense? I know that's part of what your book is about, is not being afraid of talking about death.
Definitely. I think everything you've said is so true of the way you feel. I think particularly when a child dies, that just seems to be this very uncomfortable area for most people. So that is definitely something I would hope that people might take from the book that I've written, which is called Happy Faces Only. And it is the story of Haley's medical journey, but more than just her medical journey. Her medical life was very much a part of who Haley was. And I wanted to convey in the book so much more than that. So yes, talking about people who've died for me, is okay and is what I'd want.
So is that one of the reasons you wrote the book? Can you share that with us?
When I initially thought to write the book, I didn't think it was going to be a book. I imagine, like many parents who've lost a child or had a child die, as you said too, I didn't want to forget Haley myself. I didn't want her to be forgotten by those who were close to her. Her siblings were younger when she died and wouldn't have remembered certain parts of her lifetime. And really that was important for me to capture detail about memories that they might not have themselves, but a way to share those memories with them. And for anyone who'd been involved in her life as well, and that included family and friends, of course, but extended beyond that to the healthcare professionals who honestly, through their kindness, made Haley's medical life a part of her life that was so special and enjoyable and important to her, which is really weird to say about a kid who'd been through a lot of difficult stuff. As I then started writing and it evolved a little bit, I also was starting to do presentations with you. You had introduced me to the world of sharing family stories in a healthcare setting. And very quickly, I could see the way people responded to those stories. It was almost like a thirst for needing to know that family perspective, needing to understand what it's like for parents, what it's like for children, what it's even like for their siblings and others who are involved in their story. So I think that then came through as I sort of kept writing is the other piece of it, was that it wasn't just for my family. It wasn't just for our memories. It was to help other people understand. And as you started out by saying, not be afraid of people like us, not be afraid to talk about the difficult things.
And is that one of the main messages you want healthcare professionals, if they read your book or hear you speaking, to take away? To not be afraid?
I think so. I think there are a couple of things, and I think that's definitely one of them. I think the other piece is when we had healthcare providers working with Haley when she was on palliative care, I don't think any healthcare provider treated Haley like she was the dying child. They treated her like Haley. Mm-hmm. They treated her always like she was living, because she was. She lived until she took her last breath. So I think that's another important piece. And the understanding that care of a child or a patient, whether they're young or older, involves the care of the entire family. And we definitely felt that constantly in our experiences, was that our whole family was cared for. It wasn't just about Haley. And even for Haley, it went beyond her medical needs. It included her emotional needs, all the psychosocial piece of things, which to me is extremely important too. Not saying, here's this person with a diagnosis, but here's Haley and here's what we know about her, and this diagnosis is, this is the piece we need to focus on too, but all that other stuff is important to know about Haley too. So we really know who she is and what's important to her.
Great. I was thinking about, so my book is called Bird's Eye View, and it's a book written specifically for health professionals. So I have what I call the good, the bad, and the ugly in it. So there's positive stories, certainly of kindness. There's stories about when kindness wasn't shown in healthcare settings, but how I wish it had been better. I think it's really important to be constructive. So it's a book about both, and the first part is about my son, Aaron, who has Down syndrome, and that the road I went down when I found out he was diagnosed, and all our interactions with health professionals. And then I had breast cancer 3 years ago. So I talked about that from a patient point of view. And I was just thinking about, when you're talking about kindness, is maybe we could share some examples, because one of my things that I talk about are warm blankets, and it's kind of a metaphor for all kindnesses in healthcare, and how I remember every single time a warm blanket was brought to me or my son when we were in healthcare settings, like where, you're waiting on the chair in emergency with your son, and, a nurse comes by and brings you a warm blanket. And I say, like, after you have a baby, that's like one of the best parts afterwards is they cover you up with warm blankets after you've given birth. So just thinking about some of those warm blankets and how much they mean to us families and patients. And I know from hearing you tell your story, Karen, you've got some great examples of that too. Can you give some examples of some kindnesses that were extended to Haley and your family when she was in the hospital?
Sure. And warm blankets are definitely critical to me as well. I always wanted to buy a machine like that for my home.
Yes. Yeah.
But definitely there was so much kindness extended to all of us. And I think if I can share an example that contrasts a situation where a healthcare provider was not intentionally, but not terribly kind versus another. So this one centers around communication, which is vital in kindness, if you ask me. And the first instance was with a young resident, and I'll give him a little bit of slack because he was new to his learning. But Haley and I happened to be in the ER, and she was at that time on treatment for a brainstem tumor. But we hadn't talked about her being terminal. There was no palliative diagnosis at that point. She was on active treatment with the hope that it would help her get better. So this young resident caught me, I think we stepped outside the room where Haley was, and he had a clipboard in his hand and a pen in the other hand. And so there was this little bit of a barrier between the two of us, which is okay. So, and now it would have to be 6 feet. But it was interesting the way he had this little barrier and didn't really make eye contact with me, didn't really warm up to this question, and asked, "Do you have a DNR?" And I'm thinking, DNR, okay, that's do not resuscitate. My child's 11. This is for people who are like terribly ill, they've been in a critical accident, not for my child. I just was kind of baffled by the question because it didn't make sense to me. And the way he asked it was so casual, like he pulled me over for speeding and said, "I need your license and registration." Like, no big deal, I don't care who you are, this is just my job. And it really left me feeling uncomfortable, and I gave him the answer. I said, "No, we don't," because I was kind of confused, and that was it. He walked away. That was the end of our conversation. So fast forward about 4 months, and Haley was on palliative care. The treatment had not been successful for her, and I happened to be there on a Saturday with her, which is usually a quiet day in the hospital, and the pediatrician who was doing rounds for the day came in and asked if he could speak with me in our little living room area. We had the suite in oncology, which is reserved for kids who are dying. And he invited me to go to this quiet area, just the two of us, and sit with him. So he asked me to sit on the couch. He sat next to me and turned his body towards me and put his hand on my arm. And then he spoke the very same words that the resident had said, but in a soft, gentle, compassionate tone with kindness, and said, "Do you have a DNR?" And then he added 2 more words, and he said, "For Haley." So instantly, this was more personal. This was about Haley the person, not the person on the clipboard that he had to go ask the question about. It was just such an incredible act to me of kindness in delivering information that is really unpleasant. Nobody wants to hear that. And he helped me through that moment, and we didn't have a DNR, and he helped me get that set up. So that is an example that I have that was important to me.
And you share those stories in your book, Karen?
There are plenty of instances, as you have in yours too, and maybe there's something I've read your book, and your book is phenomenal and contains, I love the contrast between, the great stories which we learn from, and then there are those difficult stories that we learn from as well. So, but I know you have great examples of kindness, and maybe you can refresh my memory on one of them.
Yeah, it's interesting because I think we actually do learn more from the harder stories, although I feel as if healthcare doesn't really solicit them very much, right? Like there's a lot, like good news stories are something that, as a system, they really want to hear about, and that seems to be really important to them. But I think it is the harder stories that we can really, really learn from, especially if we tell them in a constructive way. So you providing that contrast between that one resident and then Haley's pediatrician And basically they did the same thing. Like their what was the same, like what they did was asking about the DNR was the same, but how they did it was totally different. And I think a lot of people call those soft skills, which I think is meant as a bit of an insult, like harder ones are supposed to be harder, right? But I think in reality that soft skills, which are personal skills, interpersonal skills, working with other human beings, are actually the harder part of healthcare. I think the more technical part of healthcare is something that people can learn, right, and be taught and trained in. But it's this one-on-one piece of it that really, if it's not done well, it can cause a lot of harm. And I'd say my son who has Down syndrome, his diagnosis was not shared well with our family. As many Down syndrome diagnoses are not shared well with families, whether they're prenatal or after the baby is born. And I think that was tempered with the way when we first met Aaron's pediatrician when he was about 2 weeks old, how she treated Aaron. And it almost helped kind of heal that bad diagnosis that was given by our family doctor. So I would say I just have this image. I've got this chapter in my book called About Dr. Darwish, who was Aaron's pediatrician. And it's a beautiful story, and it's a story of actually what happened, which is why it's so beautiful. But, I just have this memory of her, knocking on the door. We were waiting in the clinic room for her to come in. Our first appointment, we were super nervous. We'd seen lots of health professionals with Aaron up to that point. We finally stumbled upon her as a pediatrician, but her knocking on the door and letting herself in and introducing herself. And the very first thing she did was, Aaron was in his car seat. She scooped him up and she held him in her arms. And she said to us, "You have a beautiful baby boy." That's what she said. That's how she started our relationship with a congratulations as opposed to an I'm sorry. And how powerful that is. Like I remember my son is 17 now. Like that was over 17 years ago that happened. And I can remember it like yesterday. It's very much imprinted in me in a positive way. And so I think health professionals have the ability to make this huge difference for families through their actions, through how they do things, not necessarily what they do. And a lot of my book talks about that too. I'm hoping that that's the takeaway after people read it, and how important those so-called small things are to patients. I just have a quick breast cancer story. I was going for my biopsy. There was a mammogram tech there who was doing the mammogram part of it, and they take the biopsy while you're in the mammogram machine. It's like terribly awkward kind of thing. And you get put in these weird positions. But I remember my hair had fallen into my face because of the way I was lying. And of course I couldn't move my arms. And I remember she came over and she like tenderly, very tenderly brushed my hair out of my eyes. And I have to say, there was this kind of a painful thing and all these, it was not a pleasant experience. But that's the one thing that made me cry, but in a very good way, right? Was her tenderness and her seeing me as a human being. So I'm kind of cheating because I know this story a little bit, but can you tell us the story of when you spoke to the radiology, the diagnostic imaging folks at the Children's Hospital, and what ended up happening afterwards? And it's a really great example of how it's not just about listening to stories. It's about taking the wisdom that patients and families share and actually doing something with them to change practice. Do you remember the one I'm talking about? Yes.
I do. It was amazing to me. It was like, gave me chills. So I hope I can describe it well. So I'll preface it by telling you a little bit of the background about the story that I shared. Haley was 5 years old. She needed surgery on her eyelid. She had a plexiform neurofibroma in her eyelid, which made her eyelid look puffy and swollen and sort of half shut all the time. So at that age, it was decided that it might be a good time to do this minor surgery to fix that eye so that Haley could be more comfortable. So the surgery was performed. Everything went well. But as we walked down the hallway towards the OR, Haley and I were walking together holding hands, and a friend we had was walking with us who happened to work there. And we heard the nurse behind us kind of giggling, and she teased Haley. She said, "I can see your underwear," because Haley was wearing a hospital gown, as people do. And this is what happened. So anyway, she goes ahead, Haley loved anything, she was very compliant with everything. So she hops up on the OR table. I say goodbye to her as she's sedated. Afterwards, everything's good. And we go home. We've got our prescriptions for pain meds, for ointments and eye drops. And it seems like this is kind of behind us now. So as the days go by, though, the swelling starts to come down, and I notice this weird flap over her eye, like this red flap coming down from her eyelid. And I have no medical background, but this doesn't look right to me. So I contact the surgeon and explain what I've seen, and he said, okay, I'll need to see her. So we go see him, and he said, yep, I've heard it can happen. Hasn't happened to me before, but we'll have to repeat the surgery. So on the way out, Haley announces to me that she's not going back. And I thought, what is happening? Haley is normally the child who will do anything. And I said, okay, I know it was painful, and I know you had those uncomfortable eye drops, and I'm trying one by one to determine what it is that's caused Haley to refuse to return. And finally she reveals that it's because the nurse teased her about seeing her underwear in her gaping gown. So I contacted the surgeon and said, I'll get her there somehow, but this is what's really bothering her. If we can do anything about this. He said, no problem. So we get there for the repeat surgery, and he arranges to double gown her. She's got one forwards, one backwards. There's no longer a gape. No one can tease her about her underwear. And Haley's happy as can be again. She marches right in. So many years later, you actually invited me to do this speaking engagement for the diagnostic imaging department, just about patient and family-centered care, key messages about, kindness in healthcare and good patient and family-centered care. And for some reason, for the DI department, I relay this story about Haley in going into the OR and having this happen. And I think nothing of it because it's just part of the whole presentation. And a few months later, I happened to be back in DI working with one of the radiologists who's invited me to come back and work on a website. They want to create a website to help people navigate their way through. And before I leave, he says, do you have a couple minutes? I have something to show you. So he leads me down the hall to the fluoroscopy room. I don't even know what fluoroscopy is, but it's this big room. And he, as I'm taking it all in, he's pointing out, the soft color that they've chosen for the walls, the fact that they've got a TV on the ceiling, so kids having this procedure done or diagnostic test done can be watching something. And they've even installed a plexiglass shield so that family, parents and siblings can be in the room to help comfort that child, but be in a safe place. And he introduces me to the technician who says to me, I was at your presentation. And because of the story you shared, I'm going to get all emotional again, but because of the story you shared, we now double gown every child who comes in here. It's automatic. We don't ask whether they feel comfortable or uncomfortable. And she said, I know it creates a little extra laundry, but it's well worth it to preserve the dignity of a child. So that was in 2011, I think, and it still gives me shivers that something that was mentioned was, as you said, not only listened to, but put into action. Something changed because of that little story that was shared.
That gives me shivers too, actually. I think about all the having breast cancer, you don't realize how important diagnostic imaging is until you're sick, right? Like they have such a big part of your life. And really kudos to the radiology department who was interested in hearing a family story and a family perspective. Like, I think it was a real champion who asked you to come and speak. And to me, it shows how stories, I always say if they touch hearts, they can change minds. So obviously there was a staff member sitting in the audience listening to you talk, and that's what she heard, that thing, we can all say, be respectful, treat people with dignity, but what does that actually really look like? So you gave a story that showed an example of really what dignity looks like. Let's end by saying, sometimes I do this with audiences, like what one word have you taken out of our conversation, and what, as far as what you'd like our audience who's watching us to remember?
It's going to sound like I'm just plugging this in because it's the gathering of kindness, but I think kindness is so critical. It seems so simple, but I'm going with kindness. How about you?
That's a good one. I'd say I use my metaphor for kindness as warm blankets. So I'd say warm blankets for everybody, healthcare professionals included.
Agreed.